for joining us today. We are now more than 120 days into the response to the crisis in this pandemic within our region. And today, I've invited our Chief Medical Officer, Dr. Ajay Kumar, to come forward and provide an update of where we are, some of our statistics, how it's impacting our people, our community, and where we stand and what our belief is in terms of the expectations going forward. Today, in Hartford Healthcare, we have 18 patients who are admitted who are COVID positive. From a testing perspective, we've tested about 1,800 people a day on average. We have 8 full-time drive-through testing centers across the state of Connecticut, and we operationalize 5 mobile testing units on any given day. So when we look at our very broad and significant testing capabilities, and I look back at the last 11,000 tests over the last 10 days or so that have come back, we look at those testing results and we're at about 0.6 positivity. So our hospital activity has remained fairly consistent, somewhere between 14 and 20 patients over a period of time on any given day admitted to the hospital who are COVID-19. And our testing has been very close to 0.6 throughout this process. In the month of July alone, we're conducting 150 mobile testing locations. And I'm enormously proud. These centers are in churches, in community centers, at schools, in nursing homes, senior living centers. We're testing significantly for the state of Connecticut, testing in big bases of employment where we have essential frontline healthcare workers. And again, the testing results, again, very similar, if not even lower prevalence across the mobile testing centers. I'm excited that when we look at testing, we now are working to do pooled testing. So the partnership that we have with Quest Diagnostics, which has served us in Connecticut extraordinarily well. Recently, the federal government has approved pooled testing, which will allow us to do faster turnarounds testing for people as the days go forward here in our region in New England, as we can do more effectively batch testing because of the low prevalence that exists within our region. We've often talked about being better than normal through this process, and I continue to believe in healthcare that we are committed to being better than normal as we emerge outside of the COVID-19 crisis. Our experience now is really looking at more innovations. So given what we've created with our large testing operation, we have more than 150 people working full-time in testing alone across Connecticut. We're challenging ourselves to look at vaccine dissemination and how can we work for flu and ultimately for COVID-19 vaccine when that would become available so that we can have better distribution, more ways to reach the community faster, more efficiently as we go forward. So we're now looking at this testing infrastructure. It's built, and we have a whole new, really, delivery system and a way to connect to our community, and we're going to leverage that as we go forward. I think the bottom line, and what we have to be most attentive to, is vigilance. We urge people to wear a mask, practice social distancing, use good hand hygiene, pay close attention to the travel requirements from the state and the hot spots and the travel restrictions. And what we've seen in our community is there's so much alignment. There's such a wonderful culture of supporting one another that our state still to this day, when we look at the transmission rate effectively, is performing really at the very top level of the country. So if I could, let me ask Dr. Ajay Kumar to come forward, our Chief Medical Officer, provide further status of what we're experiencing across Hartford Healthcare and within our state, and then both Ajay and I are very pleased to answer any questions. Thank you.
Thank you, Jeff. It's a wonderful to be part of a healthcare system who's able to get in the community and help and support the need of the citizens of state when time is crucial. And I think we've done that consistently throughout this crisis. And today I want to highlight 2 areas, especially our emergency rooms. We began the process of making sure our safety protocols are in place, a checklist is in place to make sure that every single patient who comes in is asked the right questions. Have they traveled anywhere? Do they have symptoms? every single patient who gets admitted to any of our facility, all acute facility, behavioral health facility across the system gets tested for COVID. If they have a COVID, obviously we're taking different precautions at the time. But that's the kind of a level of intensity we want to maintain and sustain here to make sure our community and patients remain safe. Every single colleague across the Hartford Healthcare is checked every single day for temperature, travel, and any symptoms at this time. And we've been very fortunate that our teams are doing an amazing job of making sure that we follow the discipline. PPE is another area. We obviously, with our supply chains work, we've optimized the supply very well in Hartford Healthcare. Then every single colleague is protected, every single patient gets a mask. And recently, when we opened our visitor policy, when to allowing the patients' families to visit and be with the patients who are in the hospital, which is, I believe, is an integral part of the care management of the patients. Really, and every single individual is getting the same amount of attention, travel history, symptoms, and everybody gets a mask here. So safety protocols, what we implemented across the state within our system has really been wonderfully adopted and done a good job. We're seeing increasing trust among our community to reach out to us and seek care at this time. Still, yesterday I was at one of our hospital and I was in the emergency room and I spoke to some of the physicians, and there's a concern here that the patients are delaying the care. They're waiting for some reminders to come through. And I think this is the time I like to assure the Hartford Healthcare facility, especially the emergency rooms, are very safe. We'd love to have you if you have any symptoms or any concerns at this time. Delaying any kind of disease is not a good idea at this time. With that, I think as Jeff mentioned, our state has done a wonderful job of maintaining the status of discipline so far. But this is the time for us to be cautious, to make sure we follow the right precautions, wearing the mask, hand hygiene, sanitization needs, avoiding travel when it's not needed. And I understand it's a vacation time for a lot of people, but social distancing, wearing a mask, and using a simple common sense precautions will help us get through this. I'm going to be back in a few minutes to answer any questions. I'm going to pass to Jeff to take any questions at this time. Thank you.
Thank you, Ajay. We're pleased to answer any questions we can.
Hi, it's John Bell from Fox 61, and I have two questions. First off, President Trump came out yesterday and he made a statement that he believes it's going to get worse before it gets better. And I wanted to see, from your perspective at Hartford Hospital, whether or not you believe that, in fact, will be a situation here in Connecticut, despite all the advances that we've made so far in the number of cases and fatalities in the last few weeks.
Certainly. When we look at Connecticut, I think what's most important, it's vigilance. Again, we watch every day what the data tells us. We're watching our testing. We look at it by community in very specific ways, and we're looking for hotspots. We do such significant testing across all of our facilities as well for anyone who receives care. We provide various testing to our staff members. So we have lots of different data points. And what's essential is that we look at this very closely. We have to prepare for the risk of a second wave. We absolutely have to prepare for the risk of a spike. And we have to ensure that we have a significant stockpile in place of personal protective equipment, which we've been building very purposely. We have to have a significant number of ventilators in place within the organization and properly functioning and ready to be distributed. We have to have plans in place on how we expand ancillary hospital beds, like when we stood up the convention center and Webster Arena and Central Connecticut State University. So all of these measures, these plans are in place, the contingencies are in place, if in fact a spike could occur or a second wave. But if at the same point in time we recognize with vigilance, with proper attention, to a very focused effort around wearing a mask, social distancing, hand hygiene, and restrictions and attentiveness to the travel restrictions, we certainly believe that we can continue to bend this curve here in Connecticut based on the measures that have been put in place, the partnerships we've put in place with our state government. So, to me, John, I would say it's a combination of staying the course and really working hard to maintain the level of performance we've had, which as a state we should be very proud of, and at the same time recognizing the risks are not insignificant. Our borders, are able to be penetrated in lots of different ways, and to the extent that there is some more exposure, we have to be ready to respond.
Thank you. And the second question I had is, this morning at 11 o'clock in Groton, there was an announcement by Pfizer with the governor, and they were talking about this, advance on a vaccine, and the fact that, the federal government has already come out and, announced that it would purchase as upwards of 100 million doses. My question is, a couple of weeks ago, we were talking about vaccines and where things stand, and I'm wondering if there's any sense of advancement on that front in the last couple of weeks that should create some optimism, or where you, from a healthcare provider, feel that this vaccine situation stands currently as of today?
Sure. Let me provide some brief comments. I'm going to ask Dr. Kumar to speak more specifically. But I would say this: we're very, very encouraged to see the announcements with Pfizer today, to see the federal government advancing a significant purchase in place around dosage. There's been many efforts from many different companies across our country and well beyond to put forth tremendous focus around the research and development of a vaccine. We at Hartford Healthcare have volunteered ourselves to work with a different trial that's also advancing right now. What I'm most pleased to see is just a tremendous focus and effort and using our extraordinary capabilities we have in the United States around development of within the pharmaceutical industry to really pivot it and focus on these vaccines. And I think today was a marker of real progress. I think there's a lot to be encouraged about, a lot to be hopeful about. And we are, and our team, and I'll ask Dr. Kumar, our clinicians are closely watching each one of these developments.
Thank you, Jeff. So, John, thanks for asking this question. I think this is a wonderful time for the scientific community to really come together and make a lot of advancement. Just to give some numbers, we have more than 147 vaccines in different stages at this time. We've got 19, I believe, in phase 1, 11 in phase 2, and 4 in phase 3 at the moment, and 1 is closer to approval. So if we look at the number of vaccines, we have the research going on, the different stages the vaccines are in right now. This is a significantly much better response, what we can imagine from our community at this time. This optimism, which I share entirely, needs to be measured with the other part as well. We're still on the early stages of understanding these vaccines. We still don't know how long the vaccines effectivity will continue after the vaccines are given. We don't know the side effects, what that would be. And mind you, these vaccines, even a small percentage of side effect could have a large implication to the large population, because, as you know, the vaccine needs to be given to the masses, not just to individual areas in some communities. So optimism is without a doubt is the right word to describe right now for what we have been able to do, but there's a caution as well on that part here. We, from the Hartford Healthcare perspective, we are really watching very carefully the recent news by some of the vaccines, which has been the successful trial they've completed, the early studies, especially about the immune response, which has been generated, especially by the neutralizing antibodies, is very promising. These are different type of techniques which are used this time. We are naive to that to a certain extent as a country, as a community. So we have a lot more learning to go through at this time.
Thank you.
Thank you. Any other questions? I'm happy to entertain. Jeff and I are here. Anything on the Facebook, Tina?
Nothing.
Okay. I'm going to have Jeff wrap it up. Thank you.
Again, thank you so much for your time and attention today. We want to reinforce that there's a lot to be encouraged about when we see kind of the level of spread and the containment that's occurring in Connecticut, and we want to urge vigilance. Wear a mask, practice proper good hand hygiene, social distancing, and really monitoring and maintaining the measures that have been put in place around the travel restrictions. Thank you very much.